The Cannabis Knowledge Exchange Hub at the Centre for Addiction and Mental Health is Ontario's professional source for credible information on non-medical cannabis. The legalization and regulation of non-medical cannabis in Canada has created a need for service providers across sectors to be able to access credible evidence in this area. CAMH's Provincial System Support Program created a Cannabis Knowledge Exchange Hub to enable service providers to connect with evidence and with each other. Our target audiences include the public health, primary care, education, and mental health and addiction sectors. In Canada, the use of non-medical cannabis continues to rise each year, including post-legalization. Recent statistics show that in Ontario specifically, 25.6% of adults and 22% of students in grades 7 to 12 reported past year cannabis use. Additionally, 13.6% of adults reported at least moderate risk of cannabis problems, and 3% of students reported symptoms of cannabis dependence. In light of these facts, dissemination of accurate and reliable cannabis information is critical, and it's anticipated that the Cannabis Knowledge Exchange Hub will meet that need. As such, the objectives of the Hub are to facilitate alignment and cross-sectoral collaborations among stakeholders, increase service provider access to and use of evidence, and support practice-to-policy communication to align system efforts at multiple levels. The Cannabis Knowledge Exchange Hub launched in January of 2019. Since then, we have convened quarterly champion circles, in person and now virtually due to COVID-19, where representatives from key organizations in each of our targeted sectors come together to share sectors' evidence needs and provide advice on how best to share information with stakeholders in their sectors. To date, we've held 9 of these quarterly stakeholder meetings. In response to the needs identified by our stakeholder champions and through annual needs assessment surveys, we've created 43 knowledge products over the past 2.5 years. These include videos, evidence briefs, research snapshots, and other resources. Our goal is to ensure that the most up-to-date evidence is getting into the hands of those who need it most, in formats that are accessible, easy to understand, and facilitate moving evidence to practice. We've also launched a fully bilingual website, www.cannabisknowledgehub.ca. This website includes our own knowledge products as well as those from other credible sources. All resources included on our website have been vetted for accuracy, currency, and lack of bias, so people know that if they find it through the Cannabis Knowledge Exchange Hub, it can be trusted. The Hub includes resources across the continuum of care, including those related to health promotion and prevention, harm reduction, treatment, and recovery. Ontario and Canadian resources are prioritized to make sure the information is most relevant to service providers. Our website also includes moderated discussion forums in English and French. Here, people can connect with other service providers to ask questions or exchange information and experiences. Our trained knowledge brokers are active on the forums and are able to direct people to the resources that are relevant to them. We have held 10 webinars and 2 annual knowledge exchange forums. In event evaluations, 87% of participants said that they gained knowledge. In longer-term follow-ups, 61% said that they had made evidence-informed improvements to policies, programs, and practice based on information received at our learning events. Finally, we've held 2 practice-to-policy dialogues, engaging a total of 48 policymakers from various Canadian jurisdictions. The purpose of these dialogues was to help align system efforts at the policy, planning, and practice levels with regards to the post-legalization cannabis environment, and ultimately to reduce harms associated with non-medical cannabis use.